So I'm Dr. Paul Leahy, one of currently 5 plastic surgeons in our group here in Leawood, Kansas, called Monarch Plastic Surgery. We have a fairly full service range of things that we do, ranging from breast surgery of all kinds. We do a lot of breast cancer reconstruction in our practice, which helps me get a lot of experience using different kinds of breast implants, which is one of the reasons how I came upon the ideal implant, actually. I'd say the biggest focus in my practice is any kind of breast surgery involving plastic surgery. And I really enjoy the cosmetic component, but also the reconstructive breast surgery that we do for people who have had breast disease. You know, I think we all believe as plastic surgeons that silicone gel implants are safe. And even if you were to have a rupture and a leak of the gel, that's not going to cause you a medical health problem. I think that's been well studied and well established. However, any of us that have gone and taken out ruptured silicone implants will tell you it can be a mess, and the silicone is very sticky, and you have to get the scar tissue around it and that sort of thing, and that can lead to other sorts of issues. And so, gosh, when you take out a saline one that's ruptured, it couldn't be easier. I mean, it's simple. And so it's come to the point where I've used this implant, the ideal implant, enough and had enough exposure to it that I really think this is something women should be considering. I'll try to give you the pros and cons and talk you through the advantages and disadvantages. I have a saline implant here, a silicone gel implant here, and then we meet in the middle with this ideal implant. It truly is I think, a blend and takes the best of both worlds. We can use a little smaller incision to get the implant in there. Because you fill it during the surgery, you can make accommodations if someone's left or right breast is a little bit different. I think it has a definitely documented less risk of it rupturing, less risk of a scar developing around the implant that's a problem, which we call capsular contracture. And I think the biggest selling point is the fact that if there's a problem with it and it does leak, well, you know instantly. I mean, there's none of this guesswork really involved in getting MRIs, and the numbers don't lie. Everything about the implant is better, including its stability and durability too. Almost every patient since we've had the implant has come back and said, this is great. We've done so many other thousands of breast implants, over our careers already. It's not like the technique is all that different. It's really just the different device that we're using. And so for that reason, it's been a pretty easy transition. True. I mean, we've taken, an implant, the saline-filled implants that have done very well for a long time. They have lots of advantages over the silicone, but they never have had the feel of the silicone. And that's really why I think women and surgeons alike have really gravitated toward the silicone gel implants to try to get a more natural feel and look. Well, now we really can combine the two together in a sense that you can get a nice feel. It's a hybrid of the two and have all the potential advantages and safety that the saline implants, I think, can offer. So I feel really confident in offering it, even though it is relatively new. But looking at the data that's already been collected and having done some of these cases already, it's just so smooth and slick to work with that I have no reservations about offering it at all.
Mm-hmm.